Hello and welcome to the Habit Coach podcast. I am Ashdin, Doctor, your habit coach, and it is Pride Month. It's such a fantastic time because there are so many changes that are taking place in our understanding of what gender is, what sex is, and understanding the way in which this fluidity is taking place. So I thought we would do a podcast on understanding what the various classifications are, what are sexual health practices that we can propagate, how to be a good ally, and how to think about fertility. Because with us, we have a fertility specialist, Dr. UV, and we did a fantastic podcast just before this. So make sure you listen to that one as well. Dr. UV, welcome to the Habit Coach podcast.
Thank you, Ashdin. Thank you.
Happy Pride Month.
Happy Pride Month.
Dr. UV, there's so much change taking place, right? Gender, sex. What is it that's happening? How can we, guide people through understanding what is taking place?
Ashdin, last year I was in a panel and we were discussing about Pride Month, and now a very dear friend of mine who identifies himself as gay and is really working for gay rights explained to me something that we are now celebrating Pride Month, but Pride Month was supposed to be a revolution.
Right.
It was a fight. And somewhere in the celebration, we still need to remember that because we are still fighting. And what are we fighting is, as you said, that, concepts have really not changed. They were already there, but I think we are acknowledging it now. We are learning it now. I'm not ashamed of saying that even as gynecologist, I passed out my gynac degree, I passed out my medicine, I started practicing, and, after a while, I kind of realized that I don't know an entire section of this sexual health regarding queer health, fertility health regarding queer health, or basic terminologies of queer. What is the difference between a gender and sex? Even today, if you ask, I'm sorry to say, but if you ask 10 gynacs, I think 5 of them might still not know what is the difference between gender and sex. And I think that is what I think the awareness is increasing. So now we are maybe understanding it more.
And getting that awareness out is so important because, how would you explain these two? How would you explain gender? How would you explain sex and break it down?
Yeah. And, before getting to that, as you said, it's important because that answers a lot of the questions in minds of what we now called heteronormative society. Because सबसे ज़्यादा लोगों को यही होता है, ऐसे कैसे हो सकता है? The first question is, how can a guy be attracted to a guy? How can a guy feel like she's not a guy and identifies herself as a female? So, यहाँ पे it's important that you know that there is something known as sex and then there is something known as gender. Most of the times we think it's the same thing. So what is sex? So sex is an identity that is assigned to you at birth.
Okay.
मतलब in our Indian context, delivery हुई, you looked physically at the child and बाहर आके, अरे बधाई हो, बेटा हुआ है, बेटी हुई है. How have you decided that? Because you saw probably the genital, the child, how he or she or they looked like. Then there is gender. So gender is the identity that you identify yourself as.
Okay.
Which means that you might have been assigned, say, a him as a boy or a male sex.
On your birth certificate?
On your birth. But then as you grew up, or any time during your life, you started feeling a disconnect. You felt you don't feel like a male. Though your body is of a male, but you connect more towards the female side of it, the identity of it. Or you connect to the male identity which was identified to you. So that's your gender. So if your gender and sex aligns, then you are a cisgender person, which means you are assigned male at birth and you identify yourself also as male and you're probably going to live your life as male.
Correct.
But if you're assigned male at birth, but you identify yourself as a female, then it's not aligning. So then that is something that we call as gender discongruence.
Okay.
Incongruence, sorry. And which is probably the trans terminology which is the opposite of cis. So that is where it is important to acknowledge that there is a difference between sex and gender. And then there is an entire group today who don't identify themselves in any category. They don't want to be labeled as a him or a her. So then these are the people who identify themselves as they. So they don't identify with any gender per se. They are known as non-binary people. And why is it important? Like, you must have people who use Instagram realize that Instagram has now added gender
Correct.
in the profile form that you fill. So more and more people are now acknowledging it, and that will help you understand that you know why would someone behave a certain way or expect you to behave and accept in a certain way.
Interestingly, because the way that you would see yourself and the way that you would see other people interacting with you, that needs to also be in line with each other.
So there was a very interesting analogy that one of the patients gave me. So they said that when you're walking on a street, like for example I know you as Ashdin, I identify you as Ashdin, and someone we've not met, I don't know you that well, and I would have seen you in the streets of Mumbai, and I would have felt कि अच्छा ये Ashdin जैसा दिखता है. The first thing you do is you go and ask, you pat on the back and you say, are you Ashdin? Just because you look like Ashdin doesn't mean you are Ashdin. So your first question is, are you Ashdin? And you would probably say, no, I'm not. Or you would say, yes, I am. So it's the same in terms of gender. Just because you look like a male, don't assume that the identity is also of a male.
Interesting.
Let's take that extra step and make an effort to know what the gender is.
Lovely. Now, the next part is about, sexual preference, right? I think that is another category and a way, it's a layer on top of this.
Yeah.
How does that fit in with what we were discussing so far? Gender, sex.
So that has no relation.
Okay.
This is about identity.
Right.
Sexual preference is something that you prefer. That's your choice. And when you talk about sexual preference, so then this entire spectrum of queer community comes into picture, which is LGBTQIA. L is lesbian, when a female is attracted to a female. Then there's gays, where men is attracted to men. And then there is asexual. So we kind of know lesbianism, we kind of know gay, but asexuality is something that we still somewhere struggle understanding. We are now in fact, interestingly, my first patient not first, but the patient that really pushed me towards kind of learning more about the terminologies, the health aspect, the science, and the medicine behind queer community and the health of queer community was an asexual person.
Wow.
She was this female who had come to me and she said, she wanted to meet me for quite a number of days and she kept on cancelling on me. So one day she actually arrived and she told me that, after a lot of resistance, she told me that, I think I'm asexual, but I don't know. Because none of us actually knew. And I was like, I have no idea. Like, I don't know how to diagnose this.
Correct.
So I told her, but we'll find out. Like, this is probably where my social media presence might help me. And we sat together and we kind of searched asexual communities. And there were so many asexual communities. We got in touch with them. I put her in touch with those communities. And then she identified herself as whatever she was. And that was the day I realized that why was I so unequipped, as a doctor? Why was I never taught? And I won't blame the education system. Yes, that's a different topic in itself. But no, it's not that everything your teacher teaches you. Why didn't I take that extra effort to learn? And that's when I started learning it. That's when I took the initiative to actually put that I am a queer-friendly doctor on my profile. And it took months. I asked 10 people first and I was scared what is going to happen to my practice, all that. But honestly, it was not a big deal. I just probably made out to be.
Yeah, I think we overthink it a lot, especially. I remember years ago when I was in college, a friend of mine was probably asexual at that time. And I feel so bad because I did not know how to deal with it. And as college kids, what you do, you tease.
Yeah.
Right. It turns into that kind of a thing. And you feel so bad now that you realize that something like that had happened. So it's important to be aware about it.
Yeah.
Especially, I'm sure you must be getting patients who are in marriages where they are asexual, right? Like, how do you even get past that?
That's very difficult. Asexual marriages, gay guys in heterosexual marriages. lesbian girls in heterosexual marriages. Um, but nowadays somehow, whether it's good or bad, I won't be able to tell you. But I'm seeing a trend where the couple have started acknowledging their
Oh,
identities.
lovely. They're
Uh,
having those
they're
conversations.
having the conversations. They know that this is the case, and then probably for whatever reasons, there might be wrong reasons, there might be right reasons, but they've still decided to stay together. But then, of course, they would require a help of a fertility specialist to get pregnant, because of course a asexual person would not be really into sexual acts that
They would
require
still
you to
be
get pregnant,
wanting to get
but
pregnant.
they would still want to have a kid.
Right.
At the same time, a gay guy in a heterosexual marriage might have difficulty,
Hmm.
so would want to then, but honestly speaking, we would require a help of a therapist, a
Right.
counselor, and that's probably the right way to go. Because I think also this through my experience. Initially, I thought, oh, मैं counsel कर दूंगा ना, मतलब ठीक है, I'll talk 1 hour with them, but then you slowly realize it's not just that. In our country, in our society, it's years of trauma.
Yeah.
It's not just about fertility. It was not just about that year or that 2 years. It's been since childhood. They might have been closeted. They are still closeted. So it's layers of counseling and lot of help that they might require. So then I realized that, I might be the best counselor in the world, but I'm not equipped to do this.
Hmm.
I'm equipped to give them a child, but they will require help.
So when it comes to queer sexual health, right? What are the things that we need to start understanding and focusing on?
So most of the time, the problem with queer sexual health is, s- m- the biggest motive of using contraception or barrier is to avoid pregnancy.
Hmm.
We tend to somewhere forget about STIs.
Right.
And with queer community, be it a gay couple, a lesbian couple, they're not afraid of pregnancy, because that part
It's
doesn't
out the
apply.
window. Right.
Exactly. So they somewhere feel or kind of let loose the protection part. And that's where they end up making a mistake. The first thing that queer health, sexual health requires is to always remain protected. And that's whether you're engaging in any form of sexual activity, be it an oral, be it anal, any form of sexual activities, you would require protection, irrespective of whether you're going to get pregnant or not. And that's the most important. I think if that is covered, 80% of the sexual health and the medical problem of queer community will go away. Because let's face it, we all know that STIs, HIV, hepatitis rates are definitely higher in the queer community till today compared to the normal community. You have to cut that.
So we'll do one.
Yeah. So I can't say normal, so that wo yaad rakhna.
Hmm.
So STIs, infections, sexually transmitted diseases are much more in queer community compared to the cis community.
Right. Absolutely. Because we've known this for a while, but
Yeah.
still you've not seen that people make that change or are more.
So uh, I've seen people make change, but then at the same time, we are still seeing, like for example, just a few months back, I had a 22-year-old guy in college who had come with an STI panel. So normally, what happens is in an
How do you do an STI panel? What is the process?
So-
What are the things that you need to check?
So STI panel is a big thing, but in India normally people do three things, which is syphilis, hepatitis, and HIV. But ideally, if you need to do a syphilis panel, then you need to add gonorrhea, chlamydia. So your doctor will add a lot of things. But ideally, regularly HIV, hepatitis और syphilis check कराते हैं. तो कभी कभी क्या होता है कि हम लोग को ये रिपोर्ट
It's a blood test.
it's a blood test. It could be a lot of other things. It could be a saliva test. It could be a swab test. So you could take a swab from your mouth. You could take a swab from your butt. But it's a blood test also. So this was a blood test. So normally we are used to seeing, like normal and abnormal as the reporting. But sometimes STI panels are reported as reactive and non-reactive.
Meaning?
So reactive is positive.
Okay.
Non-reactive is negative. So then they get confused. कि अभी ये report क्या है? So then a very young guy, 22-year-old, had come to me and he had HIV positive, hepatitis positive, and syphilis positive,
Wow.
which is dangerous. because hepatitis is going to affect your liver. For HIV, you will need to take these medicines that will, again, you can't take until your liver is normal. And syphilis is a different ball game altogether. And I've seen multiple patients like that recently in the last year. So even though the awareness and the education is increasing, I think somewhere we are still, losing or dropping the ball. Because I think, and I don't know whether this is right to say, but in my experience with the history, I've always seen that there is a history of probably alcohol abuse, partying, maybe a little bit of drug abuse there. So I always say that, people feel that, when you're partying, so it's okay. I don't mind, you have multiple sexual partners, it's to each its own. But when you're drinking, if you're partying, make sure that day is a day you don't have your one night stand.
Right.
Because you're going to lose your inhibitions.
Your choices go out the window.
Exactly.
Right? Your ability to make a choice goes out the window.
Because I've seen a consistent history. Because I think sanely you would not make that mistake.
Yeah.
I've seen these patients consistently probably had gone to a party and drank a lot and forgot, or probably used a drug, abused something and forgot.
In fact, quite a number of people have written in saying that this is the first time that, I engaged in sex and I'm now scared because we didn't use any protection.
Yeah.
Right? Because also the first time you don't think about it happening. It happens so fast. Yeah. Right? How do you...
and sometimes there's a lot of peer pressure also.
Peer pressure.
And there's a lot of... so if you're getting into like a one night stand, there are a couple of times I've seen patients who say that, the partner insisted, कि अभी क्या है, हम थोड़ी pregnant होने वाले हैं, कुछ नहीं होगा, don't fall to it. In fact, one of my patients told me there is a very... So in metro cities, hopefully, if it's happening, they said that there's a good practice. So ideally, if you are having a one-night stand with an unknown person, they ask for their STI panels.
Oh.
So they keep them in their phone. Not that having an STI panel 2 months back is like... is your green card to do an unprotected sex, but still it's something that you can still ask for. So don't be afraid to. So I think if someone is hearing this, I think I have learned this from patients that it's now normal to ask that, okay, when was your last HIV report done, and show me.
Correct.
Before engaging into whatever physical activity.
Hello, everybody. Welcome to another great week on the IVM Podcast Network. On IVM Likes, Abbas, Nehil, and Antrix do a pop culture roundup for the month of June. On Cyrus Says, with Cyrus vacationing in Spain and so not available on the episode, Kajol, Akash, Antrix, and Abbas share their paranormal experiences. On Misconduct, Ragvi and Nisha tell us the life story of Ma Anand Sheila. On The Longest Constitution, Priya takes a look at how the censor board shaped the iconic film Sholay. And on Postcards from Nowhere, Utsav tells us how Lost Treasures, Dynamite, and the Irish Nation are all connected. Just a reminder to everybody, the IVM merchandise is now available. You can go to the IVM Podcast website and click on the shop tab. Check out our first collection of t-shirts. Also, do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And I'd like to remind you all that it is really, really helpful for us when you do recommend this show or any of our other shows to a friend. Word of mouth is great for us, and it's really a great way for us to grow our audience and have more people for you to discuss your podcast consumptions with. Also, don't forget to rate us on any platform you're listening on, and you can also check us out on YouTube at ivmpodcast.com/YouTube. We have a list of the YouTube channels we are on. And finally, we'd like to thank our sponsors this week, Capgemini, Intel vPro, and Intel Future But Now Wonderful. Thank you so much for making this possible.
And I think it's one of the scariest things to actually get one panel done and look at it, because I remember years ago when the first time I got an HIV test done was when I had to go for an operation, right? And all hospitals get that HIV test done. And I was like fretting, what will happen?
Yeah.
And it's just so psychological.
Yeah, it is.
So
because we get tested regularly.
Right.
As doctors, we do get tested regularly because, sometimes you have needle breaks and this and that. So every time I have to see a panel, there's stinge of, you're scared, like... Is it going to come? Because you don't know where you're going to be exposed. And also talking about STIs, if in case you're one of those person who are now, like, you've just decided कि नहीं मुझे नहीं use करना. Not that that's the right thing. No one would advise it. But then if not, what do? So now you have options. You have something that we know as PrEP and PEP, which is like pre-exposure prophylaxis, and something known as post-exposure prophylaxis.
What does that mean?
So pre-exposure prophylaxis means suppose you are in a relationship with someone who's HIV. This is how it started. You are in a relationship with someone who's HIV positive. So you can be on these anti-HIV drugs pehle se, on regular basis, and have unprotected sex. It is going to decrease quite well your chances of transmission. It's still not a protection, but it's going to decrease your chances of getting an HIV. Also, if you're into multiple partners and you're not going to use protection, it is something you can at least do. It's like a bandage you can at least use. Other is, so pre-exposure prophylaxis, but the problem with pre-exposure prophylaxis is you'll have to keep on taking it.
It's like a pill, it's a multiple
It's a pill, yeah. So it's a combination of drugs. Basically, these are anti-HIV drugs.
Okay.
And then there is post-exposure prophylaxis.
But this is only for HIV, this is not for syphilis. and all
No,
of
it's
the
only
others.
for HIV. So, and post-exposure prophylaxis is something where if accidentally, and this is also for cis couples, this is not just for queer community.
Correct.
If you have an unprotected sex, you've forgotten to use a condom, or your condom broke, what do? Now you're scared, and you were suspecting probably that he might be HIV positive or something. Then there is a 1-month course of post-exposure prophylaxis. Those tablets, you can go to a gynec, you can go to an infectious disease specialist, and they can give you this month, but you have to start before 72 hours.
Okay.
And they can give you this so-called pills, and it will again drastically reduce your chances of getting an infection. And when you asked, this is only for HIV. What do you do for hepatitis? Well, you're lucky when hepatitis is concerned because we have a vaccine. So get yourself vaccinated. Right? There are doses of vaccine. Once you're vaccinated for hepatitis, you're protected.
Right.
And you can also do like a COVID antibody test. You can also do a hepatitis antibody test.
Okay.
Right. Syphilis, we have a treatment, luckily. No, that doesn't mean, doesn't give you, a free, card to just do an unprotected sex, but we have a treatment. The problem is with HIV and hepatitis because we don't have treatment. But hepatitis has vaccination.
Right.
So get yourself vaccinated with hepatitis.
Do you think everyone should get a hepatitis vaccine?
Everyone. And it's not just for queer community. It's for everyone. Like hepatitis vaccine, HPV vaccine. So that's human papillomavirus vaccine. Normally it's used for females for cervical cancer.
Right.
But in gay community also HPV infection is very important.
Well, HPV rates are so high, it's like if you're not HPV, you're like part of the minority now, right?
So the thing is that you will always be HPV positives most of the times, but there are different strains of HPV positive.
Okay.
Certain strains of HPV positive will give you benign conditions in females. तो जैसे वो warts होते हैं, what we call. So warts are HPV infection, but these are benign things. But HPV infection like 16 and 18 will give you cervical cancer, will give you anal cancers, will give you oral cancers. So some people, so ideally the ideal time to take HPV vaccine is between like 9 to 16 years, and before your
First
sexual encounter. And then the myth is people think that अभी तो वो हो गया तो ज़रूरत नहीं है. No, it's not like that. You might be exposed to one strain. Okay, you will not get protection against that one strain, but what about the other 8 strains? So get a vaccine. So you can take an HPV vaccine till 45 years.
Okay. So if you had to put it in plain to-do list, right? So definitely get hepatitis vaccines, right? Any doctor.
First is use protection.
First use protection. That goes without saying.
Yeah.
Right?
Second is, again, people will call me judgmental, but try to limit your sexual partners, and if till possible, like very random hookups.
Only 4
avoid
before
that.
breakfast.
Yeah.
Correct.
Second is, if at all, use protection all the time. Again, I'll butt in something else here. So when you talk about protection, it's not just about putting a condom on your penis. There's protection for oral sexual encounters also. There's protection for anal sexual encounters also, if you're doing all these different kind of activities. So only penis vagina sex, ठीक है, condom use किया है. What if you're doing like an oral sex? You still need a condom, right? If you're doing anal things, then
Or a dental dam, right?
Exactly. So that's for anal.
Correct.
So that's a dental dam. So you need protection at multiple levels. It's not just about a penetration sexual intercourse. So that second is of course protection. Third is vaccination, hepatitis, HPV vaccination, now COVID vaccination, right? And get yourself regularly tested for all these STI panels.
Okay, lovely. Fantastic. And is there a particular test that you ask for when you go to the doctor? Like, do you say STI panel, or do you say these three? How do you?
So STI panel is a panel in
So you go to
itself.
to the path lab and say
We-
STI panel karna hai.
I would never advise anyone to go to directly to a path lab.
Oh, then?
Like,
Why a doctor?
because see, one is what kind of, so there now that I'll have to elaborate. So now one, why do you need to go to a doctor? Because ek to, it just doesn't end with getting an STI panel, right? First is you need to get an education on safe sex practices. You will be baffled to know that you will still not know a lot of things.
Right.
So at least go and talk to the doctor once. Second is, there are like 20 STIs.
1 minute. What kind of doctor do I need to go and talk to?
So either it could be a gynecologist,
Okay.
either it could be a skin specialist, because so ideally a dermatologist is also a venerologist, which means they are trained in sexually transmitted diseases.
Okay.
And then there is an entire department which is known, specialization which is known as infectious disease specialist.
Wow.
So you can go to anyone.
The last one sounds very deadly. Huh. So, okay. So you find, so even as a guy, I can go to a gynac?
Yeah.
Okay. All right.
You can come for fertility, you can come for the kid, you can also come for an STI.
Fair enough. All right. So either find a gynac or find what?
A skin specialist, a
Skin
dermat,
specialist, dermat.
or an infectious disease specialist.
All right. Fantastic. Go to them, ask them, and they will suggest what panel to do.
So when you ask, is it blood? You know, so sometimes when you have had, say for example, an anal encounter, so then sometimes you can also take like a butt swab. You can take a vaginal swab. You can take an oral swab. A path lab is not going to evaluate what all kind of tests you need and what samples you need to give.
Right. So the doctor will help you with this. Fantastic.
And probably if you would have gone to a doctor and said that, oh, I had say I want to get tested for HIV because I had an unprotected sex 48 hours back, a path lab is not going to tell you, oh, you have something that is known as post-exposure prophylaxis. Let's start that so you're done. You know, you're safe.
Right.
If you would have gone to a doctor, you would have helped yourself by doing that.
Fair enough. Understood. Fertility.
Yep.
Right? How do we think about fertility and, in the queer community?
Yeah. And this is so important because now being a fertility specialist, it's also very close to my heart. You know, lot of times we end up thinking that there is no option for gay couples, lesbian couples, trans people to have their own kids. And also with the adoption laws in India being so difficult for queer community, we end up thinking कि कोई option ही नहीं है या फिर adoption ही option है.
Correct.
What about a genetic child? And I am one of those people who believes, a lot of times I get, a lot of people argue with me that, you know, why are you not promoting adoption? Look, it's great, but the onus of adoption is not on the queer community. It's on the society.
Correct.
Just because someone is queer doesn't mean that they have to adopt and they don't have an option. There is an option.
Okay.
A gay guy can have a genetic child of his own. A lesbian couple can have a genetic child of her own. A trans person can choose to freeze her eggs or sperm before getting the transformation so that tomorrow, whenever he or she decides to get pregnant or have a child, she has her own gametes and can use a genetic material of their own. You might argue, why is it important? It's not. But if it's important to you, then it's important. So what does a gay guy do?
And that's actually, you said something very profound right now. It's important to this person.
Exactly.
That is what is critical.
Yeah.
Like, don't worry about whether it's right, wrong.
Yeah.
It's irrelevant.
Like, am I coming and asking a cis hetero couple, why are you having a third child? Why don't you adopt? वो तो हम नहीं पूछ रहे. तो queer community पे adoption का onus डालने का तो logic ही नहीं है.
Absolutely.
क्यों नहीं चाहिए genetic child? Everyone wants a genetic child. Like, otherwise just stop.
Right.
Like, ask everyone to stop having genetic children. So, and also it is about a choice, right? You have to let them know that there is an option. फिर वो जो भी select करे. Then
it's
they are
up to
most
them.
exactly.
Yeah, but at least you should have options.
Exactly. They
Correct.
should know their options. So recently I was just watching this movie again, very famous, Badhai Do. Badhai, yeah, the second one, the Bhumi, where she says, you know, like she has this thing in a scene where she has this passport and she says that, you know, she was thinking to fly the country because she knew that she could never become a mother in the country. Now probably, unfortunately, the laws have changed, but ideally that was not true. Even in India, as a single, so yes, gay couples, lesbian couples, or any queer couple is not recognized as legally as couples in our country. They don't have a certificate. But you can always opt as a single parent,
Right.
right? So if you are a gay guy, you can have your genetic child. How? One, using your sperm, a donor egg, and a surrogate.
Hmm.
So a donor egg and your sperm is used, fertilized, a baby is made and is transplanted into the surrogate's uterus. The surrogate delivers the baby. This is all legal and hands over the baby to you.
Correct.
For a girl, if she's single, it's a little easier because she has a uterus. So first easy option is you can just try a donor IUI, which means she can select a donor's semen and that semen can just be injected into her uterus during her fertile period and she might get pregnant. Or she can also do an IVF, wherein you do an IVF with donor semen. And also for her, if she has a problem with her uterus or a problem in conceiving, she too has an option of using donor sperm plus surrogate.
Right.
So a gay guy can have his own child, a lesbian female can have her own child, and for the trans people, before that their transition, they can choose to freeze their semen or freeze their egg. Now, a lot of people in transition don't undergo entire transition. So there's top surgery, there's bottom surgery. So a lot of people, like for example, a lot of trans who have a uterus and are, taking testosterone injection and androgenizing themselves, converting to a trans men, they might opt for breast augmentation surgery, facial recontouring surgery, start acting and behaving and, living their life as a female, but as a male, but will still have a uterus.
Okay.
So once they've frozen their egg, say 5 years down the line, they decide that now I want to become a mother. They can stop their hormones. That same uterus can be utilized to carry a pregnancy
Wow.
and deliver a baby and then get back on the hormones and
Continue
live with
life
your
as
gender
usual.
identity.
Right.
Or else they can again use a surrogate.
It's so interesting that these options exist that we don't even know about, right? I think it's so important to know that you have choices
Yeah.
nowadays. It is not that you're stuck with it. Like you said, adopt is the only way. Why is
Yeah.
everyone forcing you? And that too is difficult to adopt in this country.
Yeah.
So there are options, and like you said, legal options that are
Yeah, but
doable.
to spoil the party, these were all all available in it. So these are all legit options. These were all available in our country. Unfortunately, the new surrogacy law has banned these procedures for single men and single women in our country. It's sad, but that's the case. But you can always go outside the country and do them.
Correct. Fair enough. So you at least have an option.
Yeah.
And if you have a baby using a surrogate in another country, it's still legally
Yeah.
accepted as
Yeah.
your child. Fantastic. Dr. UV, anything else that we've missed that you want to discuss?
I think whenever queer health is discussed, one thing that I have learned, and that's how all of us start, is by understanding the concepts. And once you take that step, there is a terminology known as an ally. The only thing we as a society can do is become a good ally. When we say become a good ally means, one, educate yourself. Tomorrow your child, your sister, your brother, anyone can come out to you. You should at least have the tools to understand them,
Correct.
if not help them.
Yes.
And very interestingly, we were discussing about queer health in a Instagram live with a group, and someone commented in the comment section that you keep on discussing about how children and young people and everyone, how can they come out and how can they tell their identity and tell their parents and their friends, and so it was of course anonymous. So they said that I'm a 55-year-old guy. I have a kid of my own, but I identify myself as a gay guy. Why don't we ever discuss how older men can come out?
Yeah.
And we forget that. So tomorrow anyone who you love dearly could come out to you. So you should at least have the tools to understand and acknowledge. Second is, I think we really need to stop using these derogatory slangs that we use in terms with when it's the queer community, associated to the queer community. वो मस्ती में हम जो बातें करते हैं, because that brings a lot of negativity and taboo in young minds in society. Third is, once you educate yourself, educate two more friends. You know, when I started talking about sex and gender and people started, it was such an interesting concept. It no, koi bore nahi hone wala. Everyone is going to be interested in this. Start a conversation, and that's going to help. And I think the last thing is that always remember, if you are privy to someone's sexual identity, it's not your dinner table conversation to have. It's not your right. You know, consider yourself lucky that that person has entrusted upon you, or maybe you've just come to know. ऐसे ही कहीं भी सोशल फंक्शंस में या किसी 5 लोगों के सामने ओ आर यू गे नहीं पूछ सकते. क्या आपको किसी ने पूछा है, ओ डिड यू हैव सेक्स विथ योर वाइफ लास्ट नाइट? इट्स वेरी सिमिलर टू दैट, राइट? So I think the last thing is, even if you suspect or if you know someone's identity, it is a personal information that you have. Leave it to them and don't make it a subject of gossip.
You said something right in the beginning that was about when you're an ally, the right tools to have, right? What are the right tools to have? One is information. What else?
I think read.
Hmm.
If you don't like reading, how I started learning is social media. Like, there are some amazing queer people doing some amazing work. You know, they'll put you to shame, you know. So ऐसा नहीं है कि ये लोग, like for example, for the longest period of time, how trans community was always associated with sex work and this and that.
Correct.
Today we have trans people doing some amazing work. Look
Fantastic.
at Sushant, look at Seisha Shinde, look at Trinetra. There's so many people, you know. Just listen to them once and you will realize how ignorant we are. Accept that. And I think the other thing that I learned was, so I did an interview with a magazine, and the magazine, it was about queer sexual health and fertility, and the magazine, the topic of the article was worded in a little bit wrong terminology, if I could say, a little bit derogatory or whatever. And then I got a few queer community NGOs who kind of messaged me. They were a little angry in terms of, you know, how could you say this, and if you should be sensitive to all this, and first of all, who are you to talk about all these things and all. And then I asked a very close friend of mine, Apurupa. She's a counselor and she's doing some amazing work. I said, you know, why are they angry? Like, no one is talking about it. I'm at least talking about it. Whatever information is getting out there, like, you know, like, it's only going to help. And she told me something that has always remained in my head, and I always tell anyone who wants to be an ally, that if you want to be an ally, you have to be open enough to accept the mistake and say that, oh, I was wrong here, I'm sorry. She said, you know, the queer community comes from ages of suppression,
Correct.
trauma, hurt. So if you're wrong, just apologize. Because you are wrong. That word was wrong. Just because you're talking about it, you're not doing a favor. So I think just be open to the concept, open to being wrong and being corrected. Only then can you be a good ally.
You know, that's such an important point, because we're so scared of having conversations because we feel that
Yeah.
we're going to say something wrong.
Yeah.
And then we keep tripping over it
Yeah.
and saying that, oh my God, what will people think? Am I being sensitive and am I insensitive?
Yeah.
I think at least have the conversation,
Yeah.
make a mistake and learn from
Learn
it.
from it.
You know, like we say, even on the Habit Coach, we keep talking about how fail fast, right? The faster you fail, more mistakes you make, the better you're going to be.
Yeah.
So have more conversations,
Yeah.
make mistakes, learn from the mistakes, don't
Yeah.
hold them personally,
Yeah.
and move on. I think that's a fantastic tip, especially for allies, on how we can move forward with this. Lovely. Yuvi, thank you so much for coming on the Habit Coach podcast. How can people get in touch with you? Where can people connect with you?
Thank you so much for having me, and I'm so happy we touched this topic. To get in touch with me, I'm on Instagram, Dr. UV, or you can find me on internet. Thank you so much. for having me.
Perfect. Thank you.